One of the things I think you had asked, we talked recently about pillars of health. Can I go there?
Yeah,
now?
let's do that now. Absolutely.
Okay, I was going to say, over the years I found basically four things, what I call the pillars of health, that I think are really important to maintaining one's health. And if I can just look at my cheater notes here.
Oh, yeah. He's got golden information here.
Yeah. So number one, the first pillar I think is eating well. And you do such a great job on your site with that.
Thank you.
So eating well, and in my view, there's two parts of eating well. Number one is making sure you're getting the sufficient amount of the nutrients you need.
Right.
Number two is getting rid of the toxicity.
Mm-hmm.
And related to the fibromyalgia, the toxic stress of all the chemicals and additives in our environment now is one of the causes. I say it's caused by stress, but it's emotional, toxic, all these different things. So getting the proper nutrients, getting rid of the toxins. And again, you do so great on that, I'm not going to go too much on that, but that's very important.
Absolutely.
Second pillar is moving well, or getting out and moving. Our society now, we're parked at a desk, we're sitting there. And now the interesting thing about movement is people actually develop arthritis because they don't move. The highest incidence of back and knee pain are people that sit at a desk all day.
Mm-hmm.
They're not
Mm-hmm.
moving. If you've ever been on a plane, and you're riding to Hawaii or something, and you're not moving, and you get out, oh, gee, your knees are all
Right.
stiff, everything's stiff. So movement is really important. We don't do that. In the past, we'd be out plowing the fields, and walking everywhere, or even in Europe and France, are riding their bike everywhere.
Right.
We're just sitting there all day. And an interesting fact is when you're doing research with animals, I think the way you create arthritis is you bind the limb
Yeah.
to them, and within a matter of days, they have arthritis.
Or just not getting any nutrients to
Mhm.
we're not getting the synovial fluid,
Right, not
which
moving.
kind of brings nutrition to the joints, and like talking about the osteoarthritis or any type of arthritis, a lot of treatments for those are to move. Even osteoarthritis,
Oh,
they're telling
sure.
you to get on those joints more, and
Right.
even though it might be painful, but
Right. Well, I was going to say, we talked about disc herniations.
Yeah.
And a disc, for example, has no blood vessels. in
Yeah.
it. Everything goes into the disc by diffusion or traction. So when you move, you create
Right.
suction, which draws the nutrients. If you're sitting there, your disc is starving. It starts degenerating, drying
Right.
out. So again, movement is a big part of that. So moving well, not only for regular exercise, or just getting out and walking makes a big difference. Get out and walk
Yeah.
for 30 minutes a day. Big, huge difference. And also getting back to the chiropractic, which deals with proper movement of the joints. Can I get off on a little tangent?
oh, sure, go for it.
One of the newest research in neurofunction and neurophysiology shows that the brain is actually energized by receptors in the joints, in the spine, and the pelvis.
Okay.
And I know you've been saying about proprioceptors.
Right.
When you move, it stimulates that fiber, sends nerve energy up to the brain. So let's say, for example, you fell off your bike and that vertebrae is cocked over in this position, it's not moving it. Even if you're moving, that joint is not moving, so you're not getting that fiber sent up.
Yeah.
And in the brain, there's both good nerve energy that comes up that makes it work better, and then there's bad nerve energy, like the nociceptors and things, that can be associated with different things, including pain, but actually technically pain is interpreted by the brain. So that's one of the reasons chiropractic works so well for overall health, is the chiropractor checks and goes, oh, that joint there is not moving.
Right.
You can be exercising all day long, doing everything, all your other joints move, that joint's going to stay stuck.
Right.
So that's why I always say, restore movement to that joint, then do the exercise.
Yeah.
So that's like some of the real new research of why the chiropractic works so well on overall health. It restores that energy going to the brain. It makes you more alert. I mean, people will tell you, oh, if you just sit there, you get tired.
Right.
You say, well, get up and do something. And then it moves those things, sends that signal up to the brain, you become more awake. It sounds kind of funny. You go out and do something, you got more energy, and before you're just laying on the couch.
Yeah.
So that's some of the new research that is just fascinating. It goes up to the brain, changes emotions, that has to do with hormonal release, all sorts of chemicals in the brain. So that's kind of a new field in chiropractic of releasing those caught joints will actually help the entire body to function better, reach that optimum health again.
Before you go on, talking about movement, and it seems like a common reaction, and you'd be a good one to talk to about this, for a lot of back injuries. Let's say it's not acute, like it's at a point where it's been going on for a long time. Mm-hmm. You might have that reaction to kind of curl up in a ball, like you have the flu or something like that, and you just want to lay there, or you might want to take a lot of painkillers and things like that. But the thing that likely, in a lot of cases, is going to help you the most is, as Dr. Kittle said, movement. Would you agree with that?
And I totally agree with that, but the thing that I want to say is different is you have to restore the movement to the spot joint with some type of adjustment or manipulation, and then do the movement. If your hip is caught up and you're on the treadmill,
right? I even mean movement as in your adjustments as well.
But the research says you should release the joint, restore the movement first, and then do the exercise. And that's a huge thing that I want everybody to really notice. If you're thinking about starting a walking program, but you're all cocked over to the side, go see a chiropractor or an osteopathic physician or a physical therapist or someone first. Get that joint functioning, and then go on.
Got some crazy dogs here.
Yeah. Hospital today. So that's a huge point. Anybody doing an exercise program, I think they should, visit their professional first to restore the movement, and then go on the program, and not just start. Because I get people in the office all the time go, I want to start walking. I started walking, and now my hip is hurting, and I can't do it. Well, they should have had the hip movement restored first, and then do the program. They wouldn't have that problem.
Okay. So far we got eat well.
Okay, yes.
Move well. Anything you'd want to add to the move well? Or
no, I think that covers it. The next one is thinking well.
Thinking well.
And a lot of huge research now on how the emotions and the attitudes of the mind affect your body.
Yeah.
Again, getting back to like chiropractic in the 1800s, they said, your brain controls all these things. So if your brain is constantly sending these negative things like, you're sick, I'm no good, blah, blah, no one likes me, that actually causes both nerve and chemical releases to your body that actually suppress your health. Okay. So mental is a big part of that. Yeah. It's huge. It's a very, and when we're treating the fibromyalgia, that also becomes a part, because when you've been in pain for all this time, you tend to get into the depression, you get into all these other things, and you don't get well. So mental, how you think, how you emote, and I actually include spiritual in that too. I say mental, but in my book it's mental / spiritual. That's a huge part of it. So thinking well, in fact, I saw some research on it that there's actually parts of your brain that will send out negative thoughts and parts of your brain that send out positive thoughts. Right. And you can actually get control of those, so you're sending out more positive and less negative. So that gets into a whole other thing, which we talked about working on a spiritual book right now, and that's addressing that part. Is addressing how you can work with different techniques to become have more of a positive attitude that's going to affect your overall health.
Well, that's great, and that's something that we talk about on this website as well, addressing that through things such as mindfulness meditation, kind of getting away from disassociating with those negative emotions and just kind of experiencing things as they are. It's not as much about maybe embracing the pain, but just realizing that it's there, and not making these negative associations with it, because it feeds, it brings a cycle, and it can continually grow to be more and more.
On that I was just going to mention that I talked about that you do have these quote pain receptors in the body, but it's only an interpretation in your mind that says that's pain. Right. It doesn't say pain. It's just this energy coming up there. When it goes to the brain, it's you that determine that is painful. You could also associate with that's pleasurable. An example is my wife hates roller coasters. I love roller coasters.
Right.
It's like, wow, a roller coaster. I associate that with, this is fun, it's exhilarating. She associates with, oh, it's bad, it's negative, oh, yeah. It's the same.
It's all perception.
Yeah, it's all how you perceive that. So
Yeah.
there are techniques you can use to break up that association. And as you know, because you've been studying neurology, you actually get these little pathways called plastic deformation. Once you get this thing, every time you do that, it makes it easier for your brain to associate. It always wants to go that, so you got to block that. And there are techniques you can do to help that. So anyway, the mental is a very important part, and I think that's going to become much more valid and important in the future as we learn more about the nervous system and the brain.
I certainly hope so. There's a lot of skeptics out there right now, but if you look at the research and the literature, it very much supports this and how much of a role it can play in recovery of a lot of different diseases, even up to cancer. I mean, you know, people going through chemotherapy and things like that. I've seen a lot of studies looking at how much more that can help with going through a difficult process like that.
It sure does. It's very important.
What's your next one?
The last one I had on my pillars of health is, now that I'm kind of pushing that 60-year-old time in my life, I've been looking a lot more about, you know, morbidity and you know, the factors that cause death, you know, in our hospitals. And so the new thing that, you know, I've been working with is I've looked at that, and it really seems like that metabolic syndrome is the big thing that's pushing the problems on there. You get the high blood pressure, you get the increased cholesterol and lipids in the blood, and you get all these problems associated with that, and all of these are associated with, and diabetes is the third one. That's filling our hospitals. It's draining our healthcare budget. If we could just get those three under control, it would be a huge, huge difference.
Yeah.
And one of the things I've been really studying is that all three of those are linked to obesity. So if you can control obesity, well, you know that we've been doing a program at our office now, my wife and I lost 60 pounds.
Right.
My wife lost 40 pounds. I used to have high blood pressure, now I don't. She lowered her cholesterol by 60 points.
Oh, wow.
So there, again, it goes all the way back to that being healthy or control it. Her doctor wanted to have her put on, you know, cholesterol medication and high blood pressure, which is okay to control it. But again, if you just get healthy, those go away.
Yeah.
And so right now, my newest my newest interest is dealing with achieving healthy body weight. I decided I'm going to go down about 20 or 25 pounds more now. Like I said, I lost 60 and decided to take a break during the holidays.
You did, huh?
Yeah, just a little bit. So now I'm going to drop down another, 25 pounds, which then helps your movement and getting back into running. So again, I think it's like getting healthy is really the answer to the health problem in America.
Oh, yeah.
So that's our new thing. We also offer that at the office. If anybody's interested, they can do that on the also on our website. Can we flash that now?
Yes. Here it is again. You're making me do a lot more editing than I was planning on doing. But there it is.
So those are my personal feeling. Those are the four things that really influence health the most. If we just did those, we would have a healthy America. We wouldn't have so many people in the hospital, so many people on all sorts of invasive procedures. If you just go for maximizing health, I just think that's so important. Back to what D.D. Palmer said way back in the 1800s.
Yeah, definitely, and we could go on forever about the obesity thing. I mean, if you don't believe that it's serious, I mean the statistics are just overwhelming. You look at our medical GDP, 80% of the costs come around that same chronic disease of obesity. And then also you look at minority populations, 1 in every 2 Hispanics are contracting diabetes, are expected to get that sometime in their life. It's out of control. I mean, it's
Black
out
Americans
of control.
with a high blood pressure. I saw a statistic the other day which was alarming. It's like 75% of all Americans are overweight. 75%. That's just crazy.
And absolutely. Well, I think we've covered a lot of ground here today. Anything else you'd like to add before we kind of wrap things up here?
No, I think we had a good time and covered a lot.
We were going to get to your other book, but maybe we'll set
okay.
up another meeting and we can do an interview part 2 sometime.
Or we could talk about my new music album next time too.
Oh, we could do that too. He's also a musician. He's a very good bassist. So, well, I wanted to thank you for listening and appreciate you taking this opportunity, Dr. Kittle here.
Like to share what I've learned over the years, and if it can help somebody, that's just great. I just love doing that.
Yeah, absolutely. Well, thank you very much for listening. This has been HealthyConsumer.com's Integrative Health Interviews, and hope to see you again soon. Thank you very much.